Good morning, everyone, and thank you for joining Diabetes and Medicare, All You Need to Know. All attendees are in listen-only mode. If you have questions during the presentation, please feel free to use the Q&A feature in Zoom, and those questions will be addressed at the end of the presentation. Now we can get started, and it is my honor to introduce to you the Executive Director of the Diabetes Foundation, Janine Salente. Janine?
Thank you all so much for being with us today. Welcome to our Diabetes and Medicare webinar presented by Mary McGeary. Mary, if you can just turn to the next slide. There, Mary and I are, there are our pictures, and we're grateful to you for coming on to learn more about this very important topic. Mary, if you can go to the next slide, please. I'm going to begin briefly by describing the work of the foundation before I turn the presentation over to Mary, who's the director of the State Health Insurance Assistance Program, SHIP, to present our webinar. As said a little earlier, there will be time for a Q&A at the end of the presentation. And throughout the webinar, as you think of a topic or a question you have, please just write it in the Q&A icon at the bottom, and I will present those questions at the end for Mary to answer. So a little bit about the foundation. For the past 30 years, the Diabetes Foundation has been helping people from Bergen County to Cape May to manage their diabetes. From free insulin, supplies, A1C testing, transportation assistance, and educational programming like our webinar today, we support diabetes prevention and management. Our educational programming alone serves more than 1,000 people a month through our webinars, our Facebook Live yoga and low impact exercise programs, and diabetes care videos, and our free medication assistance, supplies, and other tangible services. They're well known throughout the state. We work with hospitals throughout the state and we're known as an efficient, available resource to help people stay compliant with their diabetes care. Our agency is the only one of its kind in the state of New Jersey, and beyond helping thousands of people and their family, and have been helping thousands of people and their families since our inception. COVID-19 has added additional concerns for those with diabetes, and finding the right healthcare to ensure you can manage your diabetes is of utmost importance, which is why we are so grateful to Mary for being here today to bring her expertise to the Diabetes Foundation to help us and you understand how to navigate Medicare. Mary McGeary is the director of the State Health Insurance Assistance Program. It's also known as SHIP in the New Jersey Department of Human Services, Department of Aging Services. She's been working with SHIP since 2005, where she's been involved in health insurance counseling and for the aged and disabled Medicare populations. She also provides education and training on Medicare for professionals working in social services and legal, insurance, and healthcare fields. And as the director of the program, she oversees funding and training for over 400 SHIP Medicare counselors statewide. It is my pleasure to turn the presentation over to Mary. Mary, I give to you.
All righty, thank you, Janine, and good morning, everyone. And thank you for joining us today for some education about Medicare. What I'm going to be covering this morning is explaining the different parts of Medicare, what Medicare covers, and what the costs are with each of those parts of Medicare, who is eligible for Medicare, what if you have other insurance, how does that coordinate with Medicare? I'll focus in on the special services that Medicare provides for folks with diabetes. I'll talk about what the difference is between the Medicare supplement policy and the Medicare Advantage plan. And lastly, I'll cover government programs we have to help individuals afford the costs associated with Medicare. So let's get started. First, the basics about Medicare. The Medicare card is a red, white, and blue card. And Medicare is a government-sponsored health insurance. It's sponsored totally by the federal government, and the agency that oversees that is the Center for Medicare and Medicaid Services, known as CMS. Enrollment in Medicare, though, is done through Social Security or the Railroad Retirement Board if you worked for the railroad. Currently in the United States, we have over 60 million people enrolled in Medicare, so it is a very large and wide-reaching program. Medicare has 4 different parts, and many folks don't realize that, and the parts are labeled by letter A, B, C, and D. Part A of Medicare is your inpatient coverage, mostly coverage for inpatient hospital stays. Part B of Medicare is your larger medical insurance, covers doctor services, medical testing, etc. Those 2 parts of Medicare, A and B, are referred to as original Medicare or traditional Medicare. The other 2 parts of Medicare, C and D, are optional. Part C is Medicare Advantage, where you would get your hospital and medical benefits rather than through original Medicare. You would get it from a private insurance company that contracts with Medicare and gives you your benefits under a managed care program like an HMO. Part D of Medicare is the prescription drug coverage that's also offered by private insurance companies that contract with Medicare. So each of these parts of Medicare, A, B, C, and D, have different rules for who can enroll and when you can enroll. They also have different costs associated with them. Each of them have a monthly premium. Each of them have a deductible that you have to pay before Medicare or the plan will pay. And each of them have cost sharing, where you have to pay part of the service and Medicare or the plan pays part of the service. So I'm going to highlight these costs as well. First, let's talk about eligibility. Medicare covers 3 groups of individuals. The first one is what's called the aged, and the magic number is age 65. So you are first eligible for Medicare by age at age 65. You don't have to enroll at 65, but that's your first opportunity to do so. The second group are individuals who are younger than 65, but have become permanently disabled and are collecting Social Security disability. Once a person starts to collect disability, there's a 24-month waiting period, and automatically after that 24 months, the person is enrolled in Medicare A and B. The third group are those individuals of any age, even children, who have a diagnosis of end-stage renal disease. Now, for any of these categories of Medicare eligibility, it's open to all U.S. citizens or to non-citizens who are lawfully present in the United States and have lived here for 5 continuous years. Now, this is a little chart here showing how Medicare works with other types of coverage and whether you need to enroll in Medicare Part B if you have this other coverage. You see that most of the answers to this in the second column there, do you need Medicare Part B, is a yes. Because most times when you have other insurance, Medicare is responsible for paying first. So when that happens, you need both Medicare A and B to work with that other insurance. So that includes Medicaid, which is New Jersey Family Care for very low income. If you have that and then become eligible for Medicare, you need to enroll in both A and B to work with Medicaid. If you are retired and you have health coverage from a retiree health plan, and then you become eligible for Medicare, you need to enroll in Medicare A and B, and that'll pay before your retiree plan. If you are on COBRA, the same thing applies. You should enroll in Medicare A and B to work with your COBRA. The more complicated enrollment has to do with if you have employer health plan based on your current employment. Then the eligibility has to do with how large that employer is. So if you have current employer coverage and that employer has more than 20 employees, or if you're in Medicare due to disability, if that employer has more than 100 employees, you don't need to enroll in Medicare Part B. Your employer plan will still be your primary insurance, and you can delay enrolling in Medicare until you no longer are working or no longer have that employer coverage. If you are working and have employer health plan from your own employer, or maybe you're not working but you're covered under your spouse's employer plan and your spouse is working. But if that is a small employer and they have less than 20 employees, or if you're on Medicare due to disability and that employer plan has less than 100, then yes, you need Medicare Part A and B because Medicare is going to pay first before that small employer plan. Lastly, on this chart, I cover individual health plans or health plans on the health insurance marketplace. Those plans really don't work well with Medicare, so you should enroll in Medicare A and B and consider dropping out of that individual plan and instead getting a Medicare supplement policy. Now, this chart shows the costs associated in Medicare A, B, and D. As I mentioned earlier, all of them have a monthly premium. Part A, however, is usually no premium for most individuals. While you are working, one of the taxes that you pay out of your payroll tax is a Medicare tax. So if you paid into Medicare for at least 10 years during your work history, you are entitled to premium-free Part A. Part A does, however, have a deductible for an inpatient hospital stay, and currently this year it's $1,408. Now notice I have a little star next to that because that's a large amount of money. Many people, in addition to Medicare, have other secondary insurance, whether it's a retiree health plan or a Medicare supplement policy or Medicaid. If you have secondary insurance, that usually pays all or part of that large hospital deductible. Lastly, Part A has a co-payment or co-insurance. If you're in the hospital for a long stay, more than 60 days, there's a per-day co-insurance. Or if you go into a skilled nursing facility for rehabilitation, Medicare covers the first 20 days in full, and after day 20, all the way up to day 100, there's a per-day charge. Let's move over to the column for Medicare Part B. Part B has a monthly premium and it's based on income. Most individuals this year are paying $144.60 per month for the Medicare Part B. If you are a higher income and the trigger is for an individual earning more than $87,000 a year, or for a married couple earning more than $170,000 a year, you're going to pay a little bit more for your Part B monthly premium. Part B also has an annual deductible, which currently is $198. And then for the coinsurance, Part B has a 20% coinsurance, with Medicare covering 80% of all of those Part B medical coverages. Last column is for Part D, prescription drug coverage. These Part D plans have a wide range of premiums, but the averages here in New Jersey is about $37 a month for a Part D plan. Part D plans also can have a deductible. Some do not, but Medicare sets a maximum for that, and this year the maximum deductible for Part D drug plans is $435. Lastly, the Part D plans do have a co-payment or co-insurance for each medication that they cover, and that varies from plan, also varies by the prescription that you take. A little bit more about what the benefits are in your Medicare Part A inpatient coverage. So Part A mostly covers inpatient hospital stays, but Part A also covers inpatient rehabilitation in a skilled nursing facility, but they only cover up to 100 days per episode of your care. Part A also covers home health care services, hospice care for those who have a terminal illness, and pints of blood to be transfused. Part B, the medical insurance, covers a long list of items, and most of them are covered at 80% by Medicare. So doctor services are covered, and that's doctor services regardless of the doctor treating, if the doctor's treating you in the hospital or treating you in the doctor's office or treating you at home or other type of setting. Part B also covers outpatient medical and surgical services, diagnostic testing like x-rays, MRIs, and lab work, outpatient therapy, physical therapy, occupational therapy, outpatient mental health services, home health services, durable medical equipment, and this would include glucose blood testing machines and supplies, outpatient hospital services, and ambulance services are the key things that Part B pays for. Now, another complication that could be associated with diabetes is kidney disease, particular end-stage renal disease. Medicare, as I mentioned earlier, does have special coverage for individuals, regardless of how old you are, to cover you for treatment of end-stage renal disease. If you develop this condition, you need to enroll in both Parts A and B to get the full coverage, and Medicare covers dialysis at 80%. If you need a kidney transplant, Medicare also covers the cost for a transplant, both for the donor and the recipient. The coordination with Medicare and other coverage you might have is a little bit complicated under end-stage renal disease, but the Medicare coverage does start the 4th month of dialysis. And if you still have employer coverage while you're getting dialysis, there's what's called a 30-month coordination period, where your employer plan covers you for the first 30 months, and then Medicare would pick up coverage after that. You can remain eligible for Medicare coverage the whole time you're getting dialysis, or if you have a successful kidney transplant, Medicare will cover you for another 36 months after the transplant. Now I'm going to go over a chart that's available in a free Medicare book that I'll reference at the end. Some of the highlights of Medicare coverage for folks that have diabetes. First item there are anti-diabetic drugs. So those are things like the metformin. Medicare Part D drug plans cover these types of medications, and what you would pay for that depends on which of the medications you're taking and which Part D plan you enroll in. Medicare Part D also covers diabetic supplies for administering insulin, and again, the cost share differs by plan. Third row down, diabetic equipment and supplies. So as I mentioned, the Part B medical insurance covers blood sugar testing monitors and the supplies for that. Part B also covers insulin infusion pumps. Again, it's covered at 80%, your cost share is 20%. Medicare also covers insulin, and this falls under the Part D drug plans if the insulin is not administered through a pump. If you do administer insulin through an external pump, that falls under the Part B medical insurance covered at 80%. Last item there are continuous glucose monitors. That's considered medical equipment, so it falls under the Part B benefit of Medicare, and it's covered at 80% with 20% being your cost share. And again, wherever I list here 20%, if you have secondary insurance from a Medicare supplement or a retiree health plan, they will pay some or all of that 20%. Next slide, some other common complications from diabetes that Medicare covers are glaucoma test, covered under Part B. Foot exams and treatment from a podiatrist, also covered under Part B if you develop some complications from diabetes. Therapeutic shoes or inserts covered under Part B, again at 80%. Medicare also covers a yearly wellness visit and your annual flu and pneumonia shots. They're covered at 100%. There's no cost share to you if you get them from a doctor that accepts Medicare assignment. Last one on this chart are diabetic screening. If you are pre-diabetic or at risk, Medicare covers up to 2 screenings a year or more if the doctor feels it's medically necessary, and they are covered at 100%. Last slide on this chart, diabetic self-management training. This is a very essential program. If you want Medicare, you should enroll in this. This is covered under Part B to treat you to do self-management of diabetes, to help you cope with and manage it. You do need a doctor's prescription for it, but it includes up to 10 hours of training, either a one-on-one training or in a group session, as well as an annual 2 hours follow-up to this type of training. These services can be provided by diabetes educators that are certified by the ADA or the AADE, and they also have to be enrolled as a Medicare provider for Medicare to reimburse you for those costs. Lastly are the medical nutrition therapy services, covered again under Part B, and this is covered at 100%. Again, you need a prescription from your doctor to cover nutritional therapy services. So it's a long list of items. As you can see, Medicare tries to cover all aspects of treating and managing your diabetes. Lastly here is getting your flu shot. Very important, as you probably know. Having the flu can be severely compromised if you are diabetic. So everyone, regardless of your health condition, should be getting a flu shot this season. If and when a COVID vaccine is developed, Medicare will also cover that COVID vaccine at 100%. The flu shot is also covered at 100%. This slide here talks about what's not covered by Medicare. So it's important things there you should know that Medicare does not cover. And here I'm talking about original Medicare. So the first three items are common items you might need that I say that are above the neck. Eyeglasses, dental care, and hearing aids, not covered by Medicare. Long-term care in a nursing home. Home health aides, if the only thing you need is help with bathing, dressing, or housekeeping, not covered. Cosmetic surgery. Acupuncture, with the exception of low back pain, which was just approved this year. Foot care, if for those individuals that don't have diabetes or other conditions that affect the feet. Non-emergency medical transportation, home modifications, and care outside the United States, all not covered under Medicare. Now notice my little note on the bottom. If you enroll in a Medicare Advantage plan or you're low income and have Medicaid, just about all of these items are covered under those other types of insurances. So this is the little puzzle piece about your Medicare coverage. Been focusing on what's on the left-hand side here, Part A, hospital, Part B, medical. Now I want to focus on what you can have to supplement your Medicare A and B. And that's called a Medicare supplement policy. Now some folks have retiree group health plans, so you don't need to supplement your Medicare. Your retiree coverage does that. But if you don't have access to secondary insurance from your former employer, you can purchase another policy to supplement to help you pay those Medicare A and B deductibles and cost sharing. So these Medicare supplement policies are also known as a Medigap policy. They're sold by insurance companies that are licensed by the State Department of Banking and Insurance, and they're common insurance company names like Aetna, United Healthcare, Horizon Blue Cross Blue Shield. They don't cover those things that original Medicare doesn't, so they're not going to cover dental, eyeglasses, or hearing aids, but they do cover the cost gaps. So they help you cover those deductibles and coinsurance. The Medigap policies that are sold are called standardized, meaning that all of the policies cover the same benefits. Medigap policies are also labeled by letter, and their policies available are Plan A through N. The plans of the same letter will have the same coverage. So if you purchase a Plan N from Aetna, it will have the exact same benefits as a Plan N from Horizon or United Healthcare. What will differ is the premium. Each company will calculate their premium differently based on the policyholder's claims that they have. When you have original Medicare and a Medigap policy, you have the freedom to go to any doctor, hospital, or provider that accepts Medicare anywhere in the United States. Original Medicare and Medigap, there are no networks to follow, no referrals to be made, or no prior authorizations. You have the most freedom of choice with this type of coverage. There is a premium for Medigap policies that you would pay in addition to your Medicare Part B premium, that $144 a month. The premium you pay for a Medigap will vary based on your age and based on which policy you choose. So at age 65, you can get a policy close to $100 a month, but at age 80, you're probably going to be paying closer to $350 a month. So each year, the policies will go up as you age. These Medigaps are secondary to Medicare, so the doctor is going to send the claim to Medicare first, and then Medicare will send that claim to the Medigap policy. Again, they only cover the services that Medicare covers, nothing extra. The best time to buy a Medigap policy is when you first start your Medicare Part B. The first 6 months you have your Medicare Part B, the insurance company cannot turn you down for a Medigap policy. If you wait until after those 6 months, however, the company can ask you medical questions and they can turn you down for coverage. These policies also do not cover prescription drugs, so you would have to separately get a Medicare Part D drug plan to cover you for those benefits. This, we call this our STAR chart. It explains how the different Medigap policies cover different items. So you see here the Medigap policies labeled by letter, A, B, D, G, etc. Notice there are some letters missing, right? There's no E or J or H. Those policies used to be sold and are no longer offered, but these are the letters that are sold now. The policy that is right now that you can buy that is most comprehensive is the Plan G, as in girl. You see it has a star in just about every single box, right? And those stars represent those Medicare deductibles and copays. So a Medigap policy G covers all of those Medicare A and B deductibles and copays, but it does not cover the Part B annual deductible, which this year is $198. So if you have Medicare A, B, and a Medigap Plan G, you still pay your Part B premium every month, and you would have to pay the first $198 of your medical costs. But after that, your Medigap G picks up all of those other Medicare A and B costs. This chart is available on our website, on our SHIP program, which I'll reference at the end. So I've talked about Medicare A and B and Medicare supplement policies. Now I want to focus on another piece of the puzzle when you have original Medicare, and that's the Part D prescription drug plans. Now, Medicare drug coverage you can get from different avenues. The first one is to enroll in what's called a standalone prescription drug plan known as a PDP. These are policies offered by insurance companies that contract with Medicare, and they only cover prescription drugs. They don't cover you for doctor's services or anything else. It only covers prescriptions medications. You also have the option of enrolling in a Medicare Advantage plan. Those policies provide both medical and prescription benefits. Lastly, you might not need to enroll in a Medicare Part D drug plan or a Medicare Advantage plan because maybe you have coverage from your employer. That's known as creditable drug coverage. So if you have drug coverage from your retiree plan or employer plan, you don't need to enroll in a Medicare Part D. If you do need to enroll in a Part D, these plans differ. Each plan offered has a different list of drugs that they cover, and that list is called a formulary. So you have to be careful in picking a Medicare Part D drug plan to make sure you enroll in one that covers all of your current medications on its formulary. The plans also place the drugs they cover into cost tiers. Most plans have 4 or 5 tiers. The lower the tier, the lower the cost share for you. And these differ from plan to plan. So the Aetna plan might have your drug as a Tier 1 drug, but United Healthcare might have it as a Tier 3 drug. So again, this differs from plan to plan. You have to be aware of that when you're shopping for the plan. Medicare also does not cover under Part D some categories of prescriptions, like prescription vitamins, medications they consider cosmetic, like Rogaine for hair growth, and they don't cover what they call lifestyle drugs, which would be the Viagra class of drugs. The cost for Part D is one of the most confusing benefit structures out of all of the different parts of Medicare. The plans do have a premium, and it's a very large range among the premiums that are offered. This year, the lowest plan is $13 a month, all the way up to $115 a month, so it's a broad range. Again, the average is about $40 a month. The Part D plans, some of them don't have a deductible, but if they do, the maximum is $435. After you pay your deductible, you then fall into what's called the initial coverage period, where you pay a copay or a coinsurance at the pharmacy counter, and the Part D plan pays the balance. You stay in this initial coverage period until the total amount of drugs you have received for the calendar year hits $4,020. Then you fall into what's known as the coverage gap, which many people call the donut hole. If you fall into that coverage gap, you pay 25% of the cost for either generic or brand name drugs. So you get a 75% discount if you're in the coverage gap. You stay in the coverage gap until your out-of-pocket cost for the year hits $6,350. Now, these are the costs for 2020. They will be changing for 2021. You'll get out of the coverage gap. The last phase of benefit is called a catastrophic benefit, where you'll pay a small copay for the rest of the calendar year. So these are calendar year figures. If you fall into the coverage gap in December, on January 1st, you'll start all over again with deductible and initial coverage period. Now, I know this looks very confusing, but when you're in a Part D drug plan, you get a monthly statement from your Part D drug plan insurance company that explains where you are in each of these phases and how many more dollars need to be spent before you move to the next phase. So you carefully want to look at those monthly explanation of benefits to see where you are in your Part D cost sharing structure. To compare Part D plans, and this year we had 28 plans in New Jersey to choose from, you want to look at the coverage. And coverage is even more important than the cost because you don't want to enroll in a plan if it doesn't cover your medications. So you want to look at the coverage. Also, any restrictions. The plans can place restrictions on coverage of a drug like prior authorization or step therapy. Then you want to look at the cost. And you just don't want to look at the premium because it's no use being in a $13 a month plan if it's not covering your prescriptions. You want to look at what we call the total estimated annual cost. You want to look at the cost to be in that plan for a whole year, paying the premium, the deductibles, and the copays. Now, you don't need to be an accountant to figure that out. Medicare has an excellent website with a tool on it that calculates that annual cost for you. Third thing to consider is convenience. Each of the Part D plans have pharmacies, particularly preferred pharmacies where you pay even less. So you want to make sure that the pharmacy you like to use has the best co-insurance for the plan you enroll in. Last factor to consider is coordination. If you get help paying for your prescriptions from one of our state plans that I'll highlight in a moment, they only work with certain Part D plans. You want to make sure you're in a plan that'll work with any subsidies that you get. This is the Medicare website that has that Plan Finder tool on it. It's medicare.gov, G-O-V. Please do not go to medicare.com. That's a insurance site where they're going to try and sell you some policies. The official government site is medicare.gov. On that, you'll see a link that says Find 2020 Health and Drug Plans. Starting October 1, it'll say Find 2021 Health and Drug Plans. This is that green box is what the home page for the Plan Finder looks like. And you could log it there, type in your list of prescriptions, and it'll sort through the formularies of all the New Jersey Part D plans to come up with a recommendation for you for which plans cover your prescriptions at the best cost and the best coverage. Okay, so going back to our chart, I've covered everything on the left-hand side, Medicare Part A and B, Medicare supplement insurance, and Medicare Part D drug plans. Now let's look on the right side. You have another choice in how you get your Medicare coverage. Rather than having original Medicare and all those other puzzle pieces of a supplemental and a Part D, you have the option to enroll in a Medicare Advantage plan to get all of those A, B, supplemental, and D benefits combined together in one plan. And that's called Medicare Advantage. You have this choice when you're brand new to Medicare, and then every year in the fall, Medicare has an open enrollment period where you can change your Medicare Advantage plan, go back to original Medicare. If you're in original Medicare, you can enroll in Medicare Advantage every fall during open enrollment. So let's take a look at the Medicare Advantage structure. They're also often called Medicare health plans. And again, they're offered by insurance companies that contract with Medicare. So again, the common names, Aetna, United Healthcare, Horizon, and about 20 other companies offer these plans. When you enroll in a Medicare Advantage, you must get all of your medical benefits and drug benefits through the plan. claims will no longer go to original Medicare. Instead, they go through the insurance company you enroll with under the Medicare Advantage. But with Medicare Advantage, these are now called managed care. So now you have a network to follow that you need to use the doctors, the hospitals, the labs, and all other types of providers that are under contract with the Medicare Advantage plan you enrolled in. Some plans do require referrals from your primary doctor before you get a specialist. Some plans also require prior authorization for certain things. The Advantage part of Medicare Advantage, many of them have extra benefits not covered by original Medicare, the things like eyeglasses, hearing aids, and dental services. Remember that Medicare Advantage does not supplement Medicare. Instead, you're moving over from original Medicare to Medicare Advantage for your primary health insurance. When you enroll in Medicare Advantage, you still pay your Part B monthly premium, and that's usually deducted from your Social Security check. But the Medicare Advantage plan might have an additional premium. We do have many Medicare Advantage plans that are zero premium, and the premiums tend to be much lower than supplementals. So some monthly premiums might be as low as $30 or $40. The cost sharing in Medicare Advantage is different than original Medicare. You don't pay that big hospital deductible and 20% coinsurance for doctor services. Instead now, you pay whatever co-payments or coinsurance your Medicare Advantage has for each different service. Okay, so these plans are also not standardized, so it varies from plan to plan. So looking at and comparing Medicare Advantage plans is more difficult than it is in comparing Medicare supplement policies. Some of these supplemental or extra benefits that Medicare is allowing Medicare Advantage plans to offer, the list this year has grown to be quite comprehensive. Many plans now offer comprehensive dental. They'll cover you for root canals and dentures. Many of them now are offering home delivered meals after a hospital stay. Many are also covering what they call over-the-counter benefit, where they'll give you a spending card anywhere from $100 to $400 or more a year to use at the local pharmacy or through a catalog to buy over-the-counter items like adult diapers, shower chairs, cold medicine, etc. Some are also offering transportation to medical appointments, and many of them are offering worldwide coverage for emergencies. You carefully want to look at the plan's summary of benefits for the details about their cost sharing for the items and the supplemental benefits. If you're considering enrolling in a Medicare Advantage plan, you need to ask a lot of questions. The first one is my doctors and hospitals in that plan's network? Because remember, you're limited now where you can get services. You want to carefully look at the co-payments for each type of service you might be needing. You want to know if the plan offers out-of-network coverage, and if they do, what will that cost you? You want to know if referrals are required. Because these plans do also provide prescription coverage, you do want to look at the drug coverage and the cost for their drug coverage. Remember that this is your sole insurance, so you cannot enroll in a separate Medicare Part D drug plan if you're in a Medicare Advantage plan. You need to get your drug coverage from the Medicare Advantage plan. Some important things coming up with Medicare for next year in 2021. The big one that you really should be aware of is now that Medicare Part D drug plans, including Medicare Advantage plans, some of them might participate in what's called a senior cost savings model that is strictly focused on insulin. So some plans will be offering certain insulins at $35 per month for a 30-day supply all year round. There's no deductible or donut hole. So they estimate that this will save many people who use insulin close to $500 a year with this cost savings model. We'll know a little bit more on October 1st, which Part D plans and Medicare Advantage plans are participating in this cost savings model. It will be noted on Medicare's website. So you carefully want to take a look at that, and you might see, if you do use insulin on Medicare, you might see some significant cost savings next year in these plans. The other big news for next year are people with end-stage renal disease will be allowed to enroll in any Medicare Advantage plan. That was never allowed before. So this will be an alternative for folks with end-stage renal disease, another way to get their Medicare benefits. So just another word about open enrollment. It starts on October 15th and it runs through December 7th. This is the time of year, if you are on Medicare, to review your drug coverage and what's available on the Medicare Advantage market. If you are in a Medicare Advantage plan, you will have another additional 3 months until March 31st to change your coverage. But you carefully want to review your plans. The plans change every calendar year, so you want to make sure you're still in the best plan for your medical and prescription needs. If you are not happy with your plan, I encourage you to file a complaint with the plan and with Medicare. And again, carefully review your drug and Medicare Advantage coverage to see how it's going to change in both cost and coverage for next year. Lastly, I want to go over some programs we have to help with the Medicare costs if you have a limited income. I'm going to talk about Medicare savings programs, Medicaid, New Jersey PAAD, and New Jersey Senior Gold prescription discount. If individual is very low income, that is a monthly income of less than $1,064 if you're single, $1,437 if you're married, and you have assets less than $4,000. Now, when I say income, I'm talking about a gross amount of income that includes your Social Security, includes any pensions that you are getting. If you are working, includes your working income. All sources of income are counted. The assets for the program, that talks about liquid assets, what you have in a savings account, a checking account, an IRA, a certificates of deposit. Those are the things that count as an asset. The value of your home or car is not considered an asset. That is the home that you live in. New Jersey Family Care is what our Medicaid program is called here in New Jersey. That's what the card looks like. It's the white card with the blue strip on it. If you qualify for New Jersey Family Care, you will work with your Medicare, and Medicaid will pay all of your Medicare costs, your premiums, your deductibles, your cost sharing. There is a small copay for your prescription coverage of $1.30 or $3.90. Medicare is going to be your primary insurance, and Medicaid will be your secondary. You apply for New Jersey Family Care Medicaid at your County Board of Social Services. If your income's a little bit higher than the New Jersey Family Care limit, you might qualify for help in paying your Part B premium. That program is called Specified Low Income Medicare Beneficiary, or we call it SLMB, SLMB. These are the income and assets limit for that program. You see they're higher than they are for Medicaid. If you qualify for help from SLMB, you will net an additional $145 a month in your Social Security check, because that will no longer be deducted to pay your Part B premium. Instead, you can use that money for other living expenses. You would apply for this program at our State Office on Aging website, and we have a toll-free number there as well. New Jersey has two excellent prescription assistance programs. One is called Pharmaceutical Assistance to the Aged and the Disabled, known as PAAD or PAAD. It has a much more generous income eligibility, and there is no asset test. So they don't look at the amount of money you have in checking, savings account, etc. If you qualify for help from PAAD, you pay no more than $5 copay at the pharmacy counter for generic drugs, no more than a $7 copay for any brand name drugs you take. PAAD pays the premium for your Part D plan, pays the deductibles, the donut hole costs, etc. If you take Part B covered drugs, so if you did have an organ transplant and take immunosuppressives, PAAD also picks up the 20% cost share for those medications. Lastly, we have the New Jersey Senior Gold Prescription Discount Program. Much more generous income eligibility for that, and again, no asset test. If you qualify for help from Senior Gold, you pay $15 copay plus 50% of the balance, and the PAAD pays, rather the Senior Gold pays the other 50%. You do need to be enrolled in the Medicare Part D drug plan, and you have to pay the premium. Senior Gold does not pick that up, but Senior Gold does help you at the pharmacy counter with the copays. To apply for any of those programs, the SLMB, PAAD, or Senior Gold, it's one application. That application is called NJ Save, and you can apply online at aging.nj.gov, or you can just Google NJ Save and the application will come up. You can apply at any time during the year. Lastly, there's some resources here. That chart that I showed you highlighting Medicare coverage for diabetes supplies and services. That's a free publication available at the Medicare website, or you can call and have that mailed to you. The state here in New Jersey also has a diabetes self-management program that is a series of workshops that are taught by cohorts and other caregivers to show you how to manage your diabetes. And on our state website, you can find where sessions are available in your area. And as you know, because of COVID, these sessions are being offered in a virtual setting right now. Lastly, a word about the program that I work with, SHIP, S-H-I-P, State Health Insurance Assistance Program. We are a free Medicare counseling program. We have over 400 counselors throughout New Jersey available to meet with you locally. We're funded by the federal government. We're partners with Medicare. Every Medicare summary notice and Medicare new handbook lists SHIP as a reference for free help. We're unbiased. We don't sell any products or recommend any company over the other. We have a 100 hotline number for general questions. And we also have a website that has charts on it of the Part D plans, Medigap policies, and Medicare Advantage plans. Okay, so Janine, I think we can open it up for questions.
Wonderful. Thank you so much, Mary, for that informative information. Let me start. We have about 12 minutes for questions. So if you have a question, please use the below Q&A chat box and post it. So you have the first question is, because there are so many choices and it's easy to get confused, is there a way to work with someone personally to go over your best options with?
Excellent question, and that's where our SHIP program comes into place. Obviously, you can also meet with an insurance agent who sells these different products, but our program is, as I said, a free program. We're not going to sell you anything, and we can walk you through the process. When you're new to Medicare, explain again the difference between original Medicare and supplements and Medicare Advantage. Every year during open enrollment, we work with existing Medicare beneficiaries to help run those plan comparison tools. So yes, SHIP is an excellent resource. Call our 800 number. We'll refer you to your local Medicare counselor who can meet with you. Now, because of COVID, we're not doing any face-to-face meetings, but we are providing services over the phone or virtually through sessions like Zoom.
I have another question. And that is there coverage in Medicare for endocrinologists?
Yes, there are. Medicare covers all types of specialists as well as primary doctors. And as a matter of fact, yesterday as a test, if you go to the Medicare.gov website, there's a link that says Find Providers. I typed in a New Brunswick zip code for Central Jersey and said I'm looking for endocrinologists, and 60 names came up. So yes, definitely Medicare covers endocrinologists, and there's a large number that are enrolled in the Medicare program.
Okay, thank you very much. Another question. If I have a coupon for insulin, can I use that with Medicare?
Yes, you can. When you go to the local pharmacy to fill your insulin prescription, you can show the pharmacist both your coupon and your Medicare Part D drug card. The pharmacist can then calculate to see which would be the lower cost for you, and provide you the insulin, either using the coupon or your copay for your Part D. So you can't use them together, but the pharmacist will do a comparison for you to see what would be the lesser of price.
Thank you. Another question. Is there a way, we understand and are grateful to SHIP to go to you directly, and that's a free resource, which is wonderful. Is there a way to pay for individual help? Are there other
entities that provide counseling for Medicare?
Yes.
Okay. There are health consultants that you can meet with, private consultants. I don't know where you would find that. So I mean, also some financial advisors are versed in Medicare and they could assist you. But I mean, I'm not quite sure. There's no really certification for a Medicare counselor that provides counseling fee for service.
Thank you. Another question. Can people with Medicare Advantage apply for PAAD and Senior Gold?
Absolutely, yes. So because Medicare Advantage includes a prescription component, PAAD and Senior Gold will help pay the part of that Medicare Advantage premium that goes towards the drug benefit. And they will still help you at the pharmacy counter using your Medicare Advantage card, and you still pay no more than $7 copay for any prescription covered by that Medicare Advantage plan.
Okay, terrific. Are there any more questions? Yes. Can you please explain Medigap again?
Okay. So Medigap is secondary insurance. It pays after Medicare pays. So if all you had was Medicare A and B, there's a lot of big deductibles and cost sharing. So by getting a Medigap policy, that will pay after Medicare pays. And let me go back to, if I can go back to my little star chart. I'm going to get too dizzy here for a moment. Yes, so if you have Medicare A and B, you can purchase a Medigap policy. So let's look at policy D. And by the way, I highlighted Medigap D because that's the only Medigap you can buy if you're on Medicare due to disability. You can't buy the other letter policies. So if you have Medicare A and B and a Medigap, the Medigap D will pick up your hospital deductible of $1,408. So it pays, your Medigap D pays that entire hospital deductible if you have a hospital stay. If you're in the hospital for a long period of time, more than 60 days, that Medigap Plan D pays all of your daily cost sharing costs. Okay, you don't have to pay for that. Your Medigap D covers it. If you go into a skilled nursing facility for rehabilitation, your Medigap covers all of the copays after day 20. Going down to your Part B coinsurance. So when you go to see the doctor and the doctor sends the bill to Medicare, Medicare pays the doctor 80% of the cost for that visit. Then your Medigap will pick up the remaining 20%, no cost to you. The only thing you pay is the monthly premium for that Medigap Plan D. And if you're age 65, the monthly premium for most of our Medigap Plan D right now is about $130 a month for a Medigap Plan D.
Thank you. Are insurance providers required to notify people enrolled of yearly changes in their plans?
Yes, they are. So all of those types of insurances, Medigap policies, now the benefits will not change on the Medigap policy, but the premiums will. So you'll get a notice from your Medigap company letting you know when that premium's changing. The Part D plans and the Medicare Advantage plans have to send out a notice, and those notices are going out now. They have to go out by October 1st. Those notices are called an annual notice of change, ANOC. It'll list side by side the benefits you're paying for 2020 and how that's changing for 2021. So it'll show your premium for 2020, next to it the premium for 2021. your deductible for 2020, your deductible for 2021, side by side. So you need to carefully look at that document so you know what's changing. In addition, to know how your current plan is changing, you should do a comparison to see, because we are getting some new plans for next year, to see if it might be cost effective to change to a different Part D plan or change to a different Medicare Advantage plan to save additional money. So yes, notices go out, and look in your mail now for those notices if you are Medicare eligible.
Thank you. So I have 2 more questions. I'm going to roll them into one, and I think that's all the time we have for questions. It's close to the hour. The question is, do people get a warning when they're going into the donut hole or when there are changes to the drug formulary?
Okay. Yes. So the plans are required to send you a notice 60 days before they change their formulary. So if the drug that you are taking is no longer going to be covered by the plan in the middle of the year, they have to notify you that. Now, they're not allowed to take your drug off the formulary for any reason. It has to be for a significant reason, such as maybe you take a brand name drug and now a generic has been approved by the FDA. Then they could change it. Otherwise, they can't change the formulary in the middle of the year. In terms of the donut hole, you have to look at your explanation of benefits that comes from your Part D plan every month. If you carefully look at that notice, it'll tell you how close you are to reaching the donut hole. How many more dollars need to be spent before you hit the donut hole. So if you look at those monthly statements, you'll have an idea of when you're going to reach that donut hole. Now, because there's so many discounts in the donut hole now, like it's a 75% discount, sometimes your costs might go down in the donut hole and not go up. So, carefully know what the cost share is for your plan and carefully read those monthly notices that they send you. If you have any questions at all, you can call your Part D plan and they'll explain to you how to read that statement that you get.
Thank you very, very much. So that's all the time we have for questions, but it is my pleasure to let everybody know that in a few short weeks at the end of October, Mary is going to be back with us. She's going to be back with us to talk about how to register for Medicare during open enrollment. And at that time, we will make sure that she answers the last few questions that were asked during today's webinar. We want to thank you all for joining us for All You Need to Know, Diabetes and Medicare. And we hope that you look at our website, www.dfiinc.org, often for information about our ongoing programming. As soon as we will be updating the website with information about Mary's next webinar. You can also, if you prefer, sign up for our e-blasts, which announce events such as this as well. So you sign up for that on our website. The link is on the homepage. I want to give a very special thank you to Mary McGeary for helping us present this valuable topic today. We really appreciate your time and your expertise. And I want to thank everyone for coming. Have a nice day and stay safe.
Thank you. My pleasure.